So right from the get-go, you were a bit skeptical of the Affirm model, just because, as you say, it seems to go against so much that standard practice generally in any kind of therapeutic treatment. Um,
Hmm.
did you have sort of political or feminist misgivings, or was it really just as a clinician that you were concerned?
I think it was a little bit of both, including even some personal experience. So when I was in undergrad and grad school, I took a lot of sociology courses, I took some feminist courses, and I, as a young person, had my own kind of twisty, windy road of figuring out my own sexual orientation. So I had a little bit of skepticism that things are very black and white, especially in the lives of adolescents and especially in the context of gender related norms, gender related pressures, what it means to be a teenage girl versus a teenage boy. I thought that these things were complex. And I've always been really interested in group behavior. Like I almost went down the social psychology route because I was very interested in how do individuals operate in the context of groups. So that interest of mine also um, led me to be really interested in things like toxic groups or cults or extremist religions. So, like, I've always been interested in that aspect of things as well. So I think I had a little bit of a kind of political misgivings about how much the DSM criteria, for example, for gender identity disorder, as it was then called, or gender dysphoria now, it's so much based on stereotypes, and it's so, in some ways, overlapping with the experience of gay adults who will look back in their childhood history or even their current experience of masculinity and femininity and say, I sometimes feel kind of this incongruence with being female but having really masculine traits, for example, or getting along or enjoying the same interests as a lot of men. Meanwhile, I'm female, so I occupy this kind of third gender space. So those things are actually a very normal part of consolidating a sexual orientation for lots of gay and lesbian and bisexual adults. So all of these reasons made me skeptical. And of course, having worked with adolescents for so long, we know how susceptible they are to peer influence. And it's not a criticism, it's like a thing we all went through. You become porous, your identity is very malleable at that time. And that's important because that's the period of life where we're trying to sort ourselves into who we fit in with. Where do we land, in these kind of social landscapes we're part of? So all of that made me suspicious. And just the rapidity with which doctors were agreeing with a child's self-declaration made me really suspicious. And I guess another layer on top of that, which we haven't even touched on yet, was the internet and how that played a role. So specifically, there was a young woman that I had been working with for some time at this school. I knew her really well. We had a very good rapport, but she had some challenges in terms of connecting socially with others, sometimes kind of having, she'd get fixated on a specific teacher that she really didn't like, for example. And she was a little bit, I would suspect she probably had some traits of autism, undiagnosed. And anyway, at one point she told a teacher, I don't think I want you to call me by my birth name anymore. And the teacher said, what do you mean? She said, I don't think I'm a girl. And so the teacher referred her to me. We had worked together a lot. And in the course of having many conversations with her, it became really clear, she would admit, well, I was on Tumblr and I was looking stuff up. This was at the time when Tumblr was a really big thing. And she had all of this really sophisticated sounding jargon about various identity labels and binders and like all of these things that she, self-reported was coming from Tumblr, an internet chat website full of other teenage girls who are distressed about their bodies. And I thought, there's something very persuasive about a young person coming to a professional with sophisticated sounding language. And I think what's happening is doctors are like, I've heard this even in gender affirmative conferences. Well, let the patient educate you because this is a marginalized group and we don't know much about them. So allow the patient to educate you. And at the time I was like, no, like there's also a chance that these kids are getting confused by reading a lot of like big fancy sounding words and making themselves seem like they've deliberately, carefully thought this through and this is what they want. Like, I want to get a top surgery or I want a binder, when really they might be kind of being swept along in a tide, of other adolescents who are finding these things really meaningful. So lots of different reasons why I was skeptical from the beginning, which I think is interesting because the more clinicians that I talk to, what I'm starting to notice is clinicians who initially started off going along with the affirmation approach, like we're seeing this now with whistleblowers, both in the UK and here in the US, they went along with it at first. There was this little part of their instinct that said, I feel like something is weird about this, but I want to be a good person. I don't want to be transphobic. Let me put aside my biases so that I can trust the experts. We have people who are coming from very prestigious universities and teaching hospitals, and they're teaching us that this is what you do. So, I don't know what confluence of personality traits and or life experiences or factors caused me to be skeptical from the beginning, but I never really bought into the affirmation approach. And when I started my practice in 2016, I kind of naively thought, I think people are confused. And if I write a couple of good articles and I work with some patients and talk to people about what I'm seeing, nobody would want to medicalize kids if it's unnecessary, right? So everything will just course correct. That was obviously grandiose and naive at the same time. But I started my practice and got absolutely bombarded by parents who had nowhere to turn, which was confusing and shocking. How has the entire profession of psychology just forgotten everything that we know? I didn't understand. I very naively did not understand the force of kind of the activism, the political pressure, the absolute silencing of debate. I did not realize how powerful those forces were until I got thrust into it. And then I have many, many stories which helped me learn those lessons at this point.
So when you say you were bombarded with contact from parents, these parents whose children had been diagnosed with gender identity disorder or whatever, or expressing some of these ideas, and were themselves skeptical, but just felt like they had no support from other clinicians.
Yeah, these were parents who felt like something complicated was going on with their kids. Usually there was some sort of precipitating event, for example, COVID was a big one, but I started my practice before COVID. But, a precipitating event might look like, my daughter changed schools from elementary to middle school. She lost her entire friend group. She started having really serious social anxiety. And then, over the summer, locked herself in her room, binge watched YouTube videos, and came to us at the end of summer with a letter saying, I need to transition before the next school year, out of the blue. And then these kinds of parents were, of course, that's just one example. There are lots of different stories, but that's the flavor of it. And these parents were, again, taking their kids to professionals, expecting to get careful exploratory help. And the professionals were saying to these parents that your child is now a boy. You need to start referring to your daughter as a he. And I will refer you to the endocrinologist to talk about puberty blockers or hormones, depending on the age of the child. And parents were absolutely flabbergasted. So they felt like something is wrong. But, there's something incredibly powerful about an authority figure telling you your child is at serious risk of suicide. I mean, I'm sure you've heard that one before too. If you don't do this, your child will have a greater risk of suicide. And also, actually the entire paradigm of how you've been thinking about this is wrong. And sometimes parents, in an attempt to be supportive or an attempt to see how this might play out, would attempt visiting a gender clinic or a gender support group for parents. And the experience that they would have there is certain types of questions are criticized and belittled. You just have to go along. You have to be supportive and excited, and you cannot mess up on the pronouns. And the more you put aside your own instinct and follow this prescription about social transition, the more happy your child will be, when in fact that was not always the case. And it's really soul crushing. I mean, you're a parent. It's soul crushing to have a deeply felt instinct about what your child needs and then force yourself to do something diametrically opposed to that. And so the emotional and psychological toll on these parents is so hard to describe. It's palpably excruciating.
Yeah. And on the flip side as well, this is something that Helen Joyce has spoken about. She came on the podcast recently, and the 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 inverse of that is the parents who did go along with the affirmation model and did put their child on a medical pathway, and maybe now a child has had radical surgeries or hormone interventions which can't be reversed, and now that it seems as if the whole sort of edifice of the narrative is collapsing, actually those parents have a very strong incentive to cling on to it, because how awful to come to terms with the idea as a parent that you have permanently assisted in the permanent disfiguration of your child's body, basically because you were swept up in a sort of ideological movement. And I can completely see, like the horror as a parent of feeling like you've hurt your child in any way. I can see how parents would double down. But equally, like the whole, as you're describing, this whole fiasco basically arrived because of people not being honest and not doing due diligence. And
Yeah, I think that's true. And I'm sure that's true in some cases. I mean, this is whenever we are trying to wrap our minds around a phenomenon, I think we all as commentators, as concerned parties, try to summarize it or create archetypes, but there are so many complicated stories that are really different here. So I think what I would like to say is, I completely agree that there are going to be some families who, even in the face of evidence that this might have been an unnecessary medical intervention, will double down. And I think the power of narrative in the life of a human being is huge. And so there will be families that just continue to tell themselves, this was life-saving intervention for my child. If we had not done this, my child would not have been able to be his or her authentic self. Like, that's a story that I think will carry a lot of families on. But what we're starting to see now, which is really interesting, because at first I was seeing much more of the parent who from the beginning felt like something was weird about this. But what I'm starting to see now are a lot of families who are having that kind of wake up moment that you're describing, and who are doing something incredibly brave and terrifying and saying, oh my God, I don't know if this was the right move for my kid, and I'm terrified that we have done something wrong. And to those families, what I often say is, I may not use this language, but like, you are not living on an island just coming up with these ideas out of the blue. There is an entire infrastructure of the APA, the Endocrine Society, all of these organizations, all of these physicians. You go to Stanford University and their entire medical team is all kind of chiming in with the same idea that this is life-saving intervention. This is what loving parents do. And the pressure to conform is astronomical, especially when oftentimes in the background of some of these stories are actual mental health disorders and complications and suicide attempts and kids who are really struggling. And so if you think about the exhaustion of having a teenager who's just very, very much struggling to function, and then in comes this competent looking medical team that says all of those distress points that you were experiencing before may have been a symptom of gender dysphoria. And once the gender dysphoria is treated, we may see all of this resolve. And don't worry, puberty blockers are just a pause button. It gives you time to think. Do you know how much relief parents feel when they've been in and out of mental health hospitals and their kid is literally like trying to hurt themselves all the time and they think they're going to get a pause button? So I absolutely agree that in some cases, there are parents perhaps who have been, on the flippant side, or they haven't really been that invested in trying to understand this. But a lot of people are coming to realize we were being pressured in a very manipulative way by competent seeming professionals who made us feel really certain that this was the only pathway. Like, if you take your kid to a gender clinic and they have gender distress, You're not going to hear, well, there are lots of different ways we could support your kid. We could focus on just psychological exploration and experimenting with clothes, or we could do this, or we could do that. No, it's like puberty blockers are almost a first line of defense to supposedly buy time. And then what people don't recognize is like theoretically you're buying time, but in practice, something like 99% of people who go on puberty blockers go on to medicalize. So it's actually the start button of a medical process. But parents aren't really told that. Like, you've seen in Hannah Barnes's new book in the UK, people are really not informed about what they are signing their kids up for. So there's a really serious kind of responsibility on the physicians who almost refuse to look at the data. Like, I'm shocked that here in the US, you have physicians doubling and tripling down on these interventions, while the most progressive pioneering countries have all slowed down. Sweden, Finland, UK. So something weird is happening here that seems to be motivated by kind of worldview. Like, it's this twisted worldview about childhood gender that clouds the judgment of otherwise, seemingly very competent, intelligent people.